challenging time with the pandemic. It's always nice to see all of you and to get to work with the Board of Health on our urgent mission together. Today, we have two commissioners' orders that we will discuss for potential ratification. To begin, I'll conduct the roll call. I will just say your name and please say here if you're present. Gail Neowith.
You're on mute, Gail.
Maybe some difficulty unmuting.
Present.
Thank you.
Apologies.
Bill Foreman.
Present.
Karen Redlener.
Present.
Lynn Richardson.
Present.
Pamela Breyer.
You're on mute, Pam.
Whatever. Come on. Ooh, forget it. It's fine.
All right, we hear
Go
you.
ahead. Yeah.
We hear you,
Okay.
Jen. Thank you.
Sorry.
No problem. Mitch Katz.
Here.
Rosa Gill.
Here.
Sixto Caro.
You're mute.
We're on.
Here.
Thank you. And Susan Klitzman.
Here.
Thank you all. Before we discuss the items on today's agenda, let's just start with approval of the minutes from the December 11th meeting. Are there any corrections to the minutes from the December 11th meeting?
I have none.
Not.
Okay, hearing no corrections to the minutes from the December 11th meeting, may I have a motion to approve the minutes as distributed?
Move approval.
Second.
I'll move second.
Thank you. I heard Dr. Richardson with the motion, and I'm can I just have someone repeat the second? Rosa Gill with the second. Thank you. All those in favor?
Aye.
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 Thank you.
Aye.
Any opposed? All right, the minutes from the December 11th meeting are approved as distributed. The first item on our agenda is to ratify the order of the commissioner regarding vaccination reporting. Our presenter is Dr. Jane Zucker, who serves as Assistant Commissioner of the Bureau of Immunization and is also currently serving as our Vaccine Operations Center Chief. I'll now turn the meeting over to Jane. Thank you, Dr. Zucker.
Thank you, Commissioner, for the introduction. And just to confirm, my name is Dr. Jane Zucker, Assistant Commissioner for the Bureau of Immunization. Next. So just an overview of vaccination and the context for the order. In mid-December, the first COVID-19 vaccines were authorized for emergency use in the United States. And the first vaccine in the country was given on December 14th in 2020 to a nurse in Queens. A complete record of all vaccinations administered is necessary. This is for us to monitor vaccine uptake, assist administering providers in using that vaccine, to inform distribution, to guide public health outreach and other activities, as well as to ensure that we achieve equitable access to COVID vaccinations. However, there is New York State laws and regulations, as well as New York City Health Code that restrict reporting of all adult immunizations. Next. So on December 13th, 2020, a New York State executive order suspended the laws and regulations to enable complete reporting of COVID-19 vaccinations. And then on December 16th, the New York City Commissioner of Health order was issued to suspend sections of the New York City Health Code to enable reporting of adult immunizations. And the current resolution seeks to ratify the Commissioner of Health order. Next. So sorry, there's a, okay. Just a delay on the screen. So I just want to give you everyone a background about the Citywide Immunization Registry. So the registry was actually started back in 1996, and it keeps records of all people who are vaccinated in New York City, and then some records of New York City residents who were vaccinated outside of New York City. And those, for example, if they're vaccinated in New York State with a New York City address, we would get those immunizations. And the CIR data is accessible in accordance with law only to authorized healthcare providers, schools, individuals, and specific agencies to help ensure that New York City residents receive all recommended immunizations. Important for the provider side is that the registry also has decision support and helps to notify when vaccines are due. This is quite important, especially on the pediatric schedule, which is quite complex, and assists providers, again, in ensuring that children are up to date. We have used the immunization registry to enroll providers in the COVID-19 vaccine program to facilitate online ordering as well as tracking of the COVID-19 vaccines. Important to note that the CIR records are protected by strict confidentiality laws and rules, again, in terms of who can access these records. Next. So for the current, prior to the order immunization reporting, it's under New York State Public Health Law, Section 2168, and then the corresponding rules that all vaccinations administered by New York City providers to people less than 19 years of age are required to be reported to the CIR by the administering provider. Of note is that vaccinations administered by New York City providers to people 19 and older must also be reported if those immunizations are administered by a nurse or pharmacy, although this still requires consent of the recipient. Otherwise, providers of adult immunizations may report to the CIR, but also requires the consent of the recipient. And New York City, the Health Code Section 11.07 A3 has the same reporting and consent requirements as in the state public health law. Next. So the New York State Executive Order 202.82 was issued on December 13, 2020, and that was continued by subsequent New York State executive orders, and it suspends the New York State laws and rules as necessary to suspend the requirement that people 19 years of age and older have to provide consent to have their immunization information reported to the New York State Immunization Information System. So that's NICIS. The state has a different immunization registry than we do, and also suspends the consent requirement for the Citywide Immunization Registry for reporting. It also authorizes the state and city commissioners of health to include other immunization information in NICIS and CIR as applicable without consent for people 19 years of age and older who receive a vaccine in the jurisdiction. It does require that all influenza and COVID-19 vaccinations for any individual are reported to both NICIS and CIR as applicable within 24 hours of administration. Next. So the New York City Commissioner of Health order, which was issued on December 14th, following issuance of the New York State Executive Order, suspends section 11.07 A3 of the New York City Health Code to the extent necessary to require reporting without patient consent of all influenza and COVID-19 vaccinations to the Citywide Immunization Registry within 24 hours of administration, as well as all other immunizations administered to people 19 years of age and older. And that reporting shall be in a form and manner directed by the health department. Next. So There is no better graph. I think this is from our public website to demonstrate how important reporting of the COVID immunizations are. That with our COVID tracker, we can see vaccine doses administered in New York City, total doses over 600, nearly 629,000. We can see separate first doses and second doses, vaccines we have on hand. And it tells us right how well we're doing. You can see the rapid rise in immunizations over time. So this data is critical to the success of our COVID-19 vaccination program. Next. So the resolution for discussion and vote is to suspend Article 11 as necessary to require reporting of adult immunizations. This does correspond with the changes that were made by New York State to the immunization reporting requirements. And the public health benefits are many, again, including allows the department to monitor vaccination coverage levels, will allow us to conduct targeted outreach to undervaccinated groups and undervaccinating providers, as well as to increase COVID-19 immunization and other adult vaccination coverage. It will also help us to achieve our equity goals. And a more complete vaccination history and decision support will help ensure that New Yorkers receive all appropriate vaccinations and reduce the burden of vaccine preventable diseases. And just to note for COVID-19, currently we have 2 available vaccines. We may have more in the future, and these vaccines are not interchangeable except in very rare circumstances. So it's important that this information be available to the provider as well as to the individual. As sort of one example. And so the proposal, if you can go back one, I'm sorry, one more. Right, and then just to mention the text message reminders that we also are able to send reminders to people who need a second dose and haven't gotten it to ensure serious completion. And again, full protection of individuals that have been vaccinated. Next. So proposal at hand is to ratify the December 14, 2020 order of the commissioner. And Commissioner, I'll turn it over to you.
Thank you so much, Dr. Zucker, both for your presentation as well as for your efforts around the clock during our COVID vaccination efforts. So at this time, I'll open it up for questions from the board. You can either use the raise hand function or just physically raise your hand and I'll call on you. Karen and then Rosa.
Thank you, Dr. Chachi and Dr. Zucker for that overview. I guess I'm just interested in kind of the protocol. This is such an important time, and I know things are moving so quickly, but this sort of determination made by the commissioner was signed off on December 14th. So I'm just wondering, did it go into effect December 14th? And we are just needing to, ratify that decision? Or what's the normal time frame for making a decision by the commissioner and the ratification by the board?
Yes, let me start and then I'll invite Lisa to comment on it as well. And as you, I'm sure will remember from the last meeting as well, there were other commissioner's orders during our public health emergency that are made, with the speed, the expedience that's required of the crisis that we're in. We do set up meetings as soon as is feasible in order to ratify those commissioner's orders as needs to be done when there are specific provisions of the health code that are affected or other things that require Board of Health ratification. We weren't scheduled to have a regular meeting of the Board of Health until later in the spring. And so we called this special meeting for that purpose. Lisa, would you add anything to Dr. Redliner's question?
No, I think that you've summarized well, Commissioner. I think that, we're trying to do it as soon as practicable. I think we anticipated that there might well be other orders, that where it might be more efficient to do, two. Here we have two at once. We thought there might be more, but we're good with two. So I think we were trying to kind of balance a very soon short deadline with the possibility of additional orders. Hope that answers your question.
It does. It does. It makes sense. But it is kind of a, after the fact designation, which I understand the need for speed here.
Thank you. Rosa had the next question, and then Joel Foreman after that.
Thank you, Commissioner. Thank you, Dr. Zucker. Are we keeping data on ethnicity, race and ethnicity of the New Yorkers who are getting the vaccine?
I can start with that and then turn it to Dr. Zucker to elaborate. The short answer to your question is yes, we are able to capture race and ethnicity. It does depend on accurate reporting of the race and ethnicity from providers who are administering the vaccination. And in many cases, it also depends on the patient's willingness to share, one's race and ethnicity as well. So all to say, yes, we are able to capture it using the data systems, but depending on how one fills out the fields in those data systems, whether they mark unknown or not, that does affect how much of that we are actually able to capture.
Thank you.
Okay, Joel Foreman had a question as well. Dr. Foreman.
Thank you, Commissioner. Yeah, I now actually have one question and a quick clarification, but the question was, I believe I saw on a slide about reporting for adults that it included other vaccines beyond COVID-19 and influenza. And I was curious what the purpose of that
What
was,
are they?
unless I misread the slide. And then the second comment or question is that it's my understanding that in the public health emergency, these orders are issued expediently, and then the board has an opportunity to review them and hopefully in most cases affirm them. But I presume if the board didn't agree, we could counter that, although I wouldn't expect that with any of these obviously necessary orders.
Oh,
Let me start. So on the first question, yes, your clarification is exactly right. It is not only for COVID-19 vaccination, but for other adult immunizations as well. That was true in terms of what the New York State executive order authorized for the State Commissioner of Health, as well as local health commissioners to be able to do. And then my subsequent order applied to all adult immunizations as well. Dr. Zucker went through some of the rationale for why that was the case, but the one that I will just underline is how important it has been during this public health emergency to be able to follow the rates of other immunizations as well, because we have seen them fall. And so, that is a part of the justification for it being included in the commissioner's order. And then the second part of your question is relates to Karen's original question as well. And I'll ask Lisa to confirm my understanding, but the short version is yes. If the Board of Health were to vote no, then the commissioner's order would not stand. And we would have to change our practice going forward.
Yeah, that's accurate. That is accurate. That is accurate, Commissioner. Yes.
Okay, Karen, go ahead.
Thank you. This is a related question, but a little bit tangential. I'm just wondering if you could since we all are gathered here, could you give us a sense of what you expect the vaccine distribution capacity is going to be in the future? Do you have at this point a sense of the pipeline for the city or the state? And if there's any kind of summary information you could give us about that, I think we would all be interested.
Sure, I can speak to it briefly. So not this past week, but the week prior to that, when we had a greater supply of the vaccine, we were able to administer a total of 220,000 doses of vaccine in 1 week. That actually boils down to a very remarkable one New Yorker getting vaccinated every 3 seconds on average over that week. Our plans had been, again, if there were sufficient supply of the vaccine, to be able to ramp up to 300,000 vaccinations per week by the end of last week, and then 400,000 vaccinations per week this week. And the mayor has set a public goal for us to be able to ramp that up further to 500,000 vaccinations per week in February. This requires pulling out all of the stops, you know, all of our existing infrastructure, hospitals, clinics, urgent care centers, pharmacies, as well as the city-run sites that I'm grateful to be able to collaborate on with Dr. Katz, Health and Hospitals, and our DOHMH sites as well.
Do you feel that, are you optimistic about the pipeline and the supply chain?
Do you mean about the supply of vaccine from the federal government?
Yeah.
Well, we await, you know, better supply, I think is the most honest answer. The amount of supply that we're getting from the federal government at this moment is not sufficient to meet demand, nor to be able to fulfill those capacity numbers that I've described. So it does need to ramp up significantly.
Thank you.
Okay.
Pam, please go ahead.
Thank you. Can you hear me? Yes. So I understand fully that the Board of Health does not oversee operations of the health department. So I ask this just because it's hard to talk about one without the other, but at some point in this meeting, maybe at the end, could we just have a brief hear from you and maybe be able to comment on the communication plan behind all of what's happening? Because it's complicated, and I suspect there are people who really don't know quite what's going on. Anyway, but could we talk about that at some point in this meeting? Do we have time for that? Briefly.
Yes, certainly. You know, if we have some time at the end, I'm happy to speak to that. I do think it would, you know, be productive for us to make sure we get all of the questions answered for the commissioner's order, and try to move this item to a vote and then get to the next item. But thank you. I very much appreciate, you know, how important and how much attention is being paid, you know, by all of you, as well as by the public, to the vaccination campaign, given how fundamentally important it is to curtail the suffering that we're seeing from the pandemic.
Okay, great.
Any other questions on this item?
I have a question.
Please go ahead. I couldn't tell who that was, but
yes, it's Susan Klitzman. Well, first of all, thank you, Commissioner Chakshi and Dr. Zucker and all of your colleagues for these extraordinary efforts. I know a lot of the reporting that we've dealt with in the health code, it's usually electronic reporting from laboratories, but given the wide range of sites which either are or expected to give out the vaccine, could you tell us a little bit more about exactly how they will be reporting to you?
Sure, I'll turn it over to Dr. Zucker to answer that.
Yeah, thank you. And Thank you, Dr. Klitzman, for that question. So it's electronic reporting to the Citywide Immunization Registry, which is the way the only way we've actually accepted immunization records for well over since about 2007, 2008. So I will say that over 80% of our data comes in through an HL7 web service. So it's actually directly from someone's electronic medical record. And so that really comes in seamlessly through, the sort of back end into the registry. There are also other options through our online registry for providers that don't have that capacity for them to enter that. And then for other sites, we have a batch file, sort of other options, sort of lower tech options to assist other providers that may not have the EHR connection.
Thank you.
Thank you very much. Any other questions? Okay, hearing none, may I have a motion to continue the order as presented?
Motion
move.
as presented.
Second.
Thank you. I heard Dr. Katz with the motion and Karen Redlener with the second. Okay, I'll now take a vote from each remaining member. Gail Naowith.
Aye.
Joel Foreman.
Aye.
Lynn Richardson.
Aye.
Pamela Breyer.
Aye.
Rosa Gill.
Aye.
Sixto Caro. Dr. Caro, I think you were on mute.
Now? Aye.
Yes. Thank you. And Susan Klitzman.
Aye.
Okay, with a unanimous vote, the motion carries. Thank you all very much. The next item on the agenda is the ratification of the commissioner order for the COVID-19 health and safety requirements for schools. And our presenter is Lisa Landau, our general counsel.
Thank you, Commissioner, and good evening, members of the board. I will present briefly on the order regarding COVID-19 health and safety requirements for schools. Next slide, please. It's a big drum roll to the next slide, I think. Here we come. As you might remember from our meeting on December 11th, the commissioner order dated November 5th and ratified by the Board of Health on December 11th set out COVID-19 related safety requirements for students and staff at charter and non-public schools, including social distancing and mask wearing. And the order also included that students, teachers, staff members, volunteers, or any other individual providing services having close contact with confirmed cases of COVID-19 must quarantine for 14 days from that date of contact. But not long after our December 11th meeting, on December 26th, the New York State guidance was revised to conform to the CDC's change in quarantine period from 14 days to 10 days. And so we have, in light of this change, amended our commissioner order to account for this shortening of quarantine. Next slide, please. So we're asking the board to ratify the January 19th order modifying the commissioner order dated November 5th. I think we just went back, but we can go forward. Great, I see it coming. Great, and I will now turn the meeting back to the commissioner.
Thank you very much, Lisa, for that presentation and for all of the work that you and your team have been doing on these and many other orders over the last few weeks. So at this time, we will take questions from the board. Again, please raise your hand virtually or on the screen. Pam, please go ahead. We don't hear you, Pam. You're still on mute.
There, better? Yes. So I just again want to echo or underscore Karen's comments on the last presentation. I guess I never focused on the need for such a passage of time. I can only speak for myself. I mean, I'm always willing to do some special meeting to vote. It just seems like I mean, not that a month is so long, but it does seem like our own rules handicap us from, or maybe your desire to protect us from too much extra work, whatever that means. It makes it more attenuated, I guess I'll say. I guess it's always been that way, right? I just didn't focus on it.
Yes, thank you for the comment. Yes, when we're not in a public health emergency, it's very rare to have these meetings in between the normally scheduled Board of Health meetings, as you know better than I, actually. But given the cadence that we're in, we have had these multiple meetings in between the regularly scheduled ones. We do try to have at least more than one item on the slate, but we hear your feedback as well with respect to the timing.
Appreciate that. I think this order is dated January 19th, so not that long ago. The CDC change was December 26th. So we're kind of trying to roll them out. We have some other orders that we were also working on, but yes, totally understood. Thank you, Pam.
This is not a criticism. It's just to say that
everyone's available.
Yes.
Good. Thank you.
Other questions from board members? Okay, seeing none, if no further questions, may I have a motion to continue the order as presented?
Motion to
So
continue.
moved.
Second.
All right, I heard Dr. Foreman with the motion and Gail with the second. So I'll now take a vote from each member. Karen Redliner.
Aye.
Lynn Richardson.
Aye.
Pam Breyer.
Aye.
Mitch Katz.
Aye.
Rosa Gill.
Aye.
Sixto Caro.
Aye.
And Susan Klitzman.
Aye.
All right, with another unanimous vote, the motion carries. Thank you all again for your attention and the discussion. So let me briefly touch on Pam's prior question, and then we will adjourn. And Pam, let me know if I'm getting to the thrust of what you were asking, but it's specifically about communication around our vaccination efforts. And this is something that has been and will continue to be a major focus, not just for the department, but for the city as a whole.
Right.
We see this as something where certainly, we will help to lead and shape the campaign, but it really requires a whole of government response around both the operations of it as well as the communication.
Right.
We have set up under the Deputy Mayor for Health and Human Services a vaccine command center, which is charged with many of those communication efforts, whether it's reaching out to city workforce, partnering with communication across city agencies, as well as much of the public information, that is shared through our website, nyc.gov/COVID vaccine, and many of the other, channels that we have available to share information with New Yorkers. It's a regular mainstay, as many of you may know, for the mayor's press conferences, as yet another channel for communication. But equally importantly to all of those, official channels is empowering our colleagues in community-based organizations, faith leaders, others who are trusted messengers in their communities to help us with the messages that we seek to disseminate. And so this is something that remains, a work in progress with respect to the ways in which we're engaging across all of those different channels. The health department is committed to ensuring that we're providing science-based information, that we're staying abreast of the latest developments with both the vaccines as well as our plans for vaccination. So that is the snapshot overview.
Okay. Thanks.
Thank you, Pam. Okay, with that, I want to thank everyone again for your time this evening, as well as for what I know each of you is doing to further our response during this public health crisis in many ways that are very directly supportive of the health department and for the city, and in so many ways I know through the work that you do in each of the communities and institutions that you're a part of. So it's always a pleasure to get to connect with all of you, and I'll look forward to our next Board of Health meeting.
Thank you.
Thank you.
Take care.
Bye,
Bye-bye.
everybody. Bye, everyone.
Everyone.
Bye-bye.